Let's talk about provider networks. Provider networks are made up of the service providers, the doctors, hospitals, and healthcare professionals who have a contract with your health insurance policy or plan. These providers are known as in-network providers. When you in in-network providers, you generally need to pay only your deductible and any applicable copay or coinsurance. You will not be billed for the balance by the provider. Also, many preventive services provided by an in-network provider may be at no cost to you. Out-of-network providers are those doctors, hospitals, and other healthcare professionals that do not have a contract with your carrier. You may pay more to use out-of-network providers than in-network providers. If you have a PPO plan and the cost of a covered service is greater than the allowed amount by your healthcare plan, you may be responsible for the difference. This is called balance billing. In some circumstances, an out-of-network provider is not allowed to balance bill. Sometimes you may not be able to choose a provider who is in your plan's network. You may need emergency treatment, or you may see an out-of-network provider at an in-network hospital. Under the Federal No Surprises Act, you cannot be balance billed when you receive covered emergency services from an out-of-network provider or an out-of-network emergency facility when you receive covered non-emergency services from an out-of-network provider while visiting an in-network healthcare facility, unless you willingly give written consent in advance to give up your protections, or when you receive covered air ambulance services provided by an out-of-network provider of air ambulance services. If your plan does not have an in-network specialist with training and expertise to treat a condition or disease, you may request approval from your carrier to see an out-of-network specialist. If the approval is granted, your cost-sharing amount, deductible, copay, coinsurance, will be the same as if you had received the treatment from an in-network provider. However, the out-of-network provider may still balance bill you. In addition, if you are approved by your health plan to see an out-of-network specialist for mental health or substance use disorder services, your health plan must pay the cost of the out-of-network specialist services other than your cost-sharing amount, which you must pay. Your health plan must ensure that the approved out-of-network services cost you no more than you would have paid if you received the services from a provider on the plan's provider panel. This means you cannot be balance billed by the provider. You can contact your health plan using the number on the back of your card or use the link to find out the process to use for your insurance company. If your request for a referral is denied, you have the right to appeal that denial and a right to file a complaint with the Maryland Insurance Administration. If you are shopping for a new health insurance policy and you are happy with your current healthcare providers, you may want to consider policies where your current providers participate in-network. To find an in-network provider, you can start with the online provider directory. But remember, networks can change and the provider database may not be completely up to date. Calling the member service number on the back of your card can help you verify or find an in-network provider. If you have more questions about health insurance, find us online at www.insurance.maryland.gov or give us a call at 800-492-6116.